cells, things like our immune system, it's really like we're trying to fix ourselves, which is like a miraculous thing that our bodies can do.
Every healing process in the body is a stem cell mediated response, right? We actually have these little stem cells. You were to run out of stem cells, or if your stem cells stop working, you'd be dead very quickly.
What can people do to increase their number of stem cells?
Fasting has actually been shown to increase stem cell release and proliferation, partly because you're burning your fat, and there are a lot of stem cells in your fat, and they get released into circulation. So that's where you're getting a lot of them. Yeah.
When I'm short on time or out traveling, carnivore snacks are a tremendous time saver. They give me a delicious, zero cooking required meal without any weirdo ingredients. No matter what cut you choose, they're always just meat and salt. That's it. I know exactly what I'm getting, and I love them all. Use code TheCarnitarian for 15% off your order at carnivoresnacks.com. So today, I'm so excited. This is going to be a great episode, you guys. Today, we have Dr. Sabrina Solt, who is a naturopathic MD in Scottsdale, Arizona, who specializes in regenerative and anti-aging medicine. She is an expert in stem cell therapy, hormones and hormone replacement therapy, and peptides. And these are just a few of the things that she does. So, welcome to the channel, Dr. Salt. So
Thank
great to have you. Thank you for taking the time.
I'm so happy to be here. I love that you are finally doing this channel. I'm so excited to see it grow.
I'm excited about it too. I think I've only got now like 3 interviews up on the channel, so you'll be like my 4th, and I'm so excited that you're doing this. And I hope that a lot of people get a lot of great information from this, because this is an area, what you do is an area that's like, I think, relatively unexplored that should be more explored. So,
Mhm.
I mean, let's just start with a little bit of background about you. How did you get into doing this work? This, because it is very different than what standard medical doctors do. They don't usually get training in the kinds of therapies that you bring to the table. So give us a little
Yeah.
bit of your background and how you got into this.
Gosh, you're so right on that. Like a lot of what I pretty much everything that I do, I actually didn't really learn in school. I had to seek out additional trainings once I was done. I was actually very fortunate that I was able to be on a rotation where the doctor that was leading the rotation was proficient in something called prolotherapy. And prolotherapy, it stands for proliferative therapy, and it was kind of like most people's introduction into the field of regenerative medicine without using things like PRP or stem cells, which we can, I'm sure, talk about later, but it involves injecting an irritant solution, usually a base of some like dextrose, like a sugar water, plus like some lidocaine, maybe a little bit of B12, and you kind of like adjust the formula based on what you're trying to do. But you'll also use an injection technique that is actually meant to kind of irritate the area. So I had the pleasure of actually treating a gentleman back in 2013, and it was his shoulder. It was a rotator cuff injury. And over the course of several treatments, we fixed the guy's shoulder. He got off of pain medications, and he no longer qualified for having surgery to repair the rotator cuff. And I was blown away. So, as somebody that had a background in as an athlete, I did fitness competitions, I played soccer, I did some volleyball, like there was just various things in my background. I had some injuries myself, and I was like, well, this was freaking cool. Like, you just don't get exposed to that. You think that, oh, your body starts breaking down, you take the pain meds, you take the steroid injections, you eventually get surgery, and you hope and pray that it works and that you're out of pain or you're on pain meds for the rest of your life. And it just flipped the script for me so heavily on that physical medicine category of things that I was just like, I need to do this. So I kind of dove in headfirst after that and really just fell in love with the whole field of doing natural things to restore parts of the body that really we didn't have really good options for besides the drugs or surgery. And as a naturopathic doctor, a lot of what our training is in is, of course, the root cause medicine. So we get to the root cause of things. And people, I think, would brush off chronic pain and chronic injuries as not necessarily being a root cause. But when you sit back and look at the effect that it has in somebody's life, they can be incapacitated. They can't go out and do the things that they love. They can't show up as their best self because they're in chronic pain all the time. And to me, it really became this mission to heal people at that level so that they can be their best selves in so many other ways and really just live how they want.
I mean, it's amazing. I think that kind of focus on regenerative medicine rather than just trying to go in there, cut someone open, physically fix something that maybe we could fix sort of on our own with a little bit of help from these injections. Can you
Mhm,
explain a little bit? I mean, now just getting into those kinds of therapies, starting with something like stem cell therapy.
mhm.
I mean, can you give us a little primer on what that is and how that works and how our bodies use that therapy to regenerate where a surgery would maybe not be as effective as stem cell therapy?
Such a great question. So, technically, every healing process in the body is a stem cell mediated response, right? We actually have these little stem cells, and they're called pericytes, not parasites, Pericytes.
Mhm.
And they are kind of like these little stem cells that kind of like are wrapped around our blood vessels. And so, if an injury or something happens, they just kind of go right into motion and start to heal and regenerate. But if you were to run out of stem cells or if your stem cells stop working, you'd be dead very quickly, like within an hour or so. So everything in our body is
Mm.
technically run by these guys, and they heal pretty much anything. The kind of art of regenerative medicine and what we do in clinical practice is being able to utilize stem cells from various sources, whether we take them from your own body via your own fat or your own bone marrow, or we get donated birth tissue like placental matrix or a Wharton's jelly, or even an exosome product, that we utilize these in a specific fashion based on what the patient's needs are to actually make the area heal that we need to heal. And what's really cool is that the body responds usually very, very well because it wants to heal. I try to have these conversations with people sometimes where everything that the body is doing is technically it trying to heal itself. You can make this argument for a lot of things, right? One thing common in the carnivore space is this increase in cholesterol when somebody goes carnivore. And what we can actually often attribute that to, and I won't say all the time in every person, but we can often attribute that to, is the body trying to increase cholesterol as a repair molecule to finally start to heal years of damage that may have occurred at the cellular level, because, well, every single cell in our body is made of cholesterol. So
Mm.
there's a mountain of evidence surrounding why stem cells can be effective for certain things. And it simply just has to do with the fact that they are these primitive cells that can turn into, become other cells, or influence the body in certain ways to carry out these repair processes.
It's fascinating to me the whole way the system is set up that we just go on about our day healing ourselves constantly. And some people go on about their day thinking they're getting sicker and sicker, but really what's going on inside of them is nothing but our own bodies trying to help
Yeah.
ourselves. I mean,
Yeah.
so things like stem cells, things like our immune system, it's really like we're trying to fix ourselves, which is like a miraculous thing that our bodies can do. So
Yes.
where do you typically, like, inject stem cells? Can they go anywhere and then repair locally, or do they travel? Like, how does that work?
Both, actually. Yeah. So, for the listeners, there isn't a part of the body that I haven't treated with stem cells or regenerative injections, and you can use your imagination for that. We've done head to toe and everywhere in between. So, we can do local injection, of course. So, if somebody has a shoulder injury, like a damaged rotator cuff, if they've got a bad hip, bad knee, bad low back, whatever it is, we can treat there. What's really cool is that sometimes when we do treat these local areas, we actually see changes in other parts of the body. Don't ever guarantee that, but one of the
Okay.
properties of stem cells is that they have a homing mechanism. So they can actually detect if there's other parts of the body that are giving off like inflammatory signals or sending out inflammatory cytokines, and they can home in on those areas and start to heal and regenerate. We also can put them intravenously, and really that does allow them to travel throughout the whole entire body via the circulatory system, and they can seek out those areas of damage and inflammation and start those healing cycles. So that really even also includes things like neurological disorders, any sort of immune dysfunction stuff. So autoimmune disorders we've worked with as well. Even just anti-aging properties. I've had some patients who are just like, yeah, I just want them to go in and clean up any mess that might be in there and just see how I feel afterwards. And we've seen things like people's eyesight improving. They stopped needing the prescription glasses that they were using. Their hair has started growing better. General aches and pains have gone away. Just really, really interesting and fascinating and incredible stuff.
I mean, it sounds incredible. I wonder why everyone is not given the option. I understand it's a pretty costly thing, but it's like do you see this as the future of medicine generally and things like surgery just sort of falling out of favor and allopathic medicine just falling out of favor in I mean, where are
It
we
d
going, right? Like, this would be amazing.
it depends, costly, I think, like, it's cheaper than a knee replacement for most people, depending on
Mm.
what their insurance covers. But every kind of person has a different every provider, I should say, has different price points on how they're doing this. And it usually depends on various factors, level of experience, what you're doing with the patient, what those packages include. But you're usually looking at several $1,000s for these because they usually involve a surgery plus the processing time, plus all your follow-ups and things like that. But as far as where we're going in the future with this, I would love to see regenerative medicine as kind of our first line therapy before going to reparative surgeries. So, if somebody has, say, like a torn labrum, for example, we would maybe try stem cells first, knowing that we do actually have a ton of great literature that backs it up. Like, it's not just like we're out here just doing this for fun and like hoping for the best. There is piles of research that have already been done. Plus, if you go on like clinicaltrials.gov, you can see that there are even additional trials still in the works, and people are all the time submitting, to their IRBs, the investigational review boards, to even develop more studies so we can continue to see how these things can be effective. But if we could get these as the first line therapy prior to surgery, you're going to save so many thousands of dollars in these surgical procedures for these patients, for these insurance companies. Of course, there are going to be some people that lose money, like the surgeons and the hospitals and all these other places. But you're going to get patients, I at least feel, better outcomes, right? Because once a surgeon goes in there and cuts the tissue and damages it to some degree, now it's been changed in a way that is no longer, we'll say, native to the body. Whereas if you're going to try something like stem cells first and at least exhaust that option, you can at least you at least tried, right? Like, we at least tried to repair the area. And there are definitely time and a place for surgery, right? Like, for example, a complete rotator cuff tear. If you actually completely tore the rotator cuff and there are two strands that are no longer connected, the stem cells aren't necessarily going to bring those guys back together and kind of sew them back together, whereas a surgeon could. So, time and a place for both, but I think it's a matter of how fast are we moving towards one option versus the other. And at the very bare minimum, I would love to at least see, stem cells, PRP, other regenerative therapies just completely kick cortisone out, because cortisone is
Mm.
one of the worst things you can inject. Not only does it negatively impact the patient's immune system, but it's actually going to further strip minerals from the bone. It's going to further damage and degenerate the cartilage that you're injecting it into. It can cause things like weight gain. People can have insomnia develop as a result of it, which means you're going to lose some regenerative capabilities that you would normally get within your sleep. It's just bad news bears. And all it does is possibly reduce pain in some populations if the mechanism of your pain is something that cortisone works on. Some people, it doesn't work at all.
It really seems to be just like a Band-Aid temporary fix, just a pain
Mhm.
management kind of a thing, like a Tylenol would be. But like you
Yep.
said, the side effects are far greater than what a pain
Yep.
medication would be. So
Exactly.
you had mentioned PRP, platelet rich plasma. Am I saying that right?
You got it. Mhm.
What is the difference then between that plasma injection and a stem cell injection? And why would you choose one over the other?
Such a great question. So PRP, it's something that we take from your own blood. So it's no more challenging to acquire than a simple blood draw. And what we're doing is we are putting that sample into a centrifuge, and then the centrifuge settings that we use will do a couple of things. It's going to separate out the different parts of the blood. So the red blood cells from the white blood cells from the plasma. And the platelet rich part of the plasma is generally, when it separates out, about the bottom one third. And then the centrifuge settings that we use will often cause an increase in the number of platelets by anywhere from 10x to 100x. So we're actually increasing the actual number of volume of the platelets that are in there. So greater regenerative potential. Now, what's present in the platelets are mainly things called growth factors and cytokines. There really isn't any stem cells actually present in there. So they're just going to function a little bit differently. When you put in PRP, the easiest, simplest explanation that I can give you is that it's going to go in there, it's going to execute a job, and that's about it. It's going to do like one healing cycle, we'll say, which is about 6 to 12 weeks. So, generally speaking, the results that you get from that singular injection are the results that you're going to get. And you may need additional ones to keep the healing kind of going. It's going to take care of one thing. You may go to the next level. So, for mild concerns and certain other applications, PRP can work phenomenally well. For really, really serious stuff or a deep amount of damage, that's usually where we want to go towards stem cells because they behave differently. So stem cells, they could actually still, secrete those growth factors and those same cytokines. Sometimes we'll even actually combine PRP with the stem cells. But another thing that stem cells can do is they can actually self replicate. So they can make more of themselves if there is more needed to actually carry out the process. But they can actually continue these regenerative processes for many months. So you can get multiple healing cycles from one stem cell injection versus the PRP, which is kind of like, hey, what you're going to get is what you're going to get. You'll know how you're doing in about 6 to 12 weeks. Stem cells, they've been shown in some studies that you can actually continue to detect stem cells at the site upwards of 6 months later, some in some cases even up to a year later.
That's incredible. And one point that you just said that I'm very curious about,
Mhm.
stem cells regenerating themselves,
Mhm.
sounds like the fountain of youth to me. What can people do to increase their number of stem cells?
I mean, fasting has actually been shown to increase stem cell release and proliferation. Um, I mean, there are some supplements out there that people claim will increase stem cell release. I am still investigating that claim as far as I don't know. Like, I think that there is so many factors that can play into that that I just don't know. But fasting does work really well. You can get a lot of release of that, partly because you're burning your fat, and there are a lot of stem cells in your fat, and they get released into circulation. So that's where you're getting
Interesting.
a lot of them. Yeah.
That's fascinating. We just as a side note, we got a question when I put the box up on Instagram. Somebody asked about platelet-rich plasma or other things as an adjuvant to surgery. Would you use them like after a shoulder surgery? This question specifically was about a biceps surgery. So would you recommend doing both? And would it be stem cells or PRP with a surgery?
It really depends on what they're doing in the surgery. There are actually a lot of surgeons these days that are really kind of getting into this stuff, and they will actually also use PRP or bone marrow sometimes within their surgeries. I've seen this in some knee surgeries for sure and some hip surgeries. So, about finding a surgeon that can do that. But afterwards, if we're going to treat afterwards, I usually like there to be a window of time whereby we kind of see what healing occurred from the surgery itself before we top up with another regenerative treatment. And it's because there's the way that the body heals, it heals in timelines and it heals in stages. So, no matter what, anytime you get an injury, it always starts with an inflammation phase. And that inflammation phase can usually last anywhere from 3 to 7 days. So, whether you get a cut, whether you have a surgery, whether you get stem cells, inflammation starts first. And this is why some people will actually feel a little bit worse right after a treatment because we're starting a brand new healing cycle, especially with PRP. PRP, you really do feel that initial inflammatory response. It's a good thing though, tells us we're starting that cycle. And then the second stage is where we get into the proliferation stage. And I kind of like to refer to this stage as like, okay, say you're building a house, and this is where all the building materials get dropped off. And so it can look like things are really starting to come together, and you may actually even feel better at this point because some of the inflammation has started to go down. But this is where it really becomes even the most important to take it easy because you don't want to re injure at this point because you could actually arrest the healing process. So, super important the proliferation phase, like take it easy. And this phase can last usually the first 30 days, sometimes up to 6 weeks. And then we get into the final phase, which is the remodeling phase. So if we're talking about like a PRP treatment, we usually hit the remodeling phase somewhere between 30 days and 6 weeks, and it usually continues for an additional 6 weeks. So by the time 3 months hits, we've seen the results. Now, with stem cells, that remodeling phase can go again and go again and go again for 6 months to a year. But the reason that we would want to make sure that we are timing it after a surgery appropriately, at least 6 weeks, is because we want to see how the body has already gotten through those stages of healing and what still needs to be treated. So, is there still a certain type of pain picture? Is there nerve involvement? Is there some sort of like muscular atrophy that we need to address? It's best to see how that shakes out and see what needs kind of our attention.
That's amazing. Thank you so much for answering that question
Mhm.
so thoroughly. I think that's going to be very helpful for people who are thinking about going and getting something right after a surgery or in lieu of a surgery. Now, on to another topic, which is the hot topic, which is I think a favorite topic for a lot of people currently, is peptides,
Mhm.
specifically the current favorites being the GLP-1 agonists and similar. So, talking about things like Ozempic, Wegovy, the semaglutide, the Mounjaro, which is the tirzepatide. What is your take on this? This is something that you provide. Are you a fan of? What are your thoughts on this
Yeah,
phenomenon?
I've been using those peptides in clinical practice for 2, if not 3 years now before they were ever, like, in the news, and I've seen some really cool results. I will caveat this before, like, people start coming for me with their pitchforks, is that you have to use it in the right patient at the right dose for the right reasons, honestly. So, not everybody gets it, not everybody qualifies for it. You have to have the basics dialed in. I think where we're seeing a lot of these sensationalized headlines in the news with people having these really, really severe side effects is that it was the wrong person and it was the wrong dose. They were severely overdosed. They were already like a hot and inflamed, carby mess. And of course, things went haywire. You hear the stories, a common side effect, I will say, of people saying that, oh, I felt so nauseous. I got violently ill. I had terrible diarrhea. I had all this GI stuff. What they fail to tell you is the mechanism of why that's happening to these people who are in really rough health, right? So, my patients that are mainly on a protein based diet, animal based diet, they don't get those results. And the reason is because of their microbiome. Their microbiome doesn't necessarily host these bugs that are feeding on sugar and carbs. Now, when you give somebody a medication like this that really dramatically changes how their body handles sugar and carbs getting in and it clears it a lot faster, well, now these bugs are starving and they're angry and they're dying. And that process now shows up to you like nausea and vomiting and diarrhea. And if you never change your diet, you're never going to stop having that disturbance. But if you do switch to more of like a protein based diet, fat based diet, and your microbiome no longer has to die off or deal with this dramatic shift, you completely take that side effect off the table. And now there's really nothing to write home about because we know that a lot of these other like claims like thyroid cancer, pancreatic issues have been disproven in the literature. One just needs to go look for those. So, and again, it's
Mm.
dosing too. So you can definitely get it in high, like those side effects in high dosing, but starting with microdoses, my goal is to do the lowest possible dose to get the results that we want and only go up as needed, which means we're usually often dosing a tenth of what a regular doctor would prescribe.
Wow. I mean, because you do hear these claims of some really serious side effects. The one that sticks out in my mind is like stomach paralysis, and
Mhm.
that then you're just messed up forever for taking these. So I'm very wary of them. But now there are alternatives to this that people will say, like, well, metformin can be used this way, or a supplement like berberine can be used this way. Do you find those at all effective, in what people are trying to achieve, which is mainly weight loss? When are those called for, or is it not effective?
It's I can see what people are doing with, like, trying to make these connections and assertions. Bear brain isn't gonna behave the same way as these GLP-1s as far as just kind of how it binds and how it does its effect. With berberine, you're going to get some reduction in like your circulating glucose because of just how it takes it up and how it can make your cells possibly more sensitive to it, but it's not going to behave the same way that the GLP ones are. Now, if somebody want to start there, of course, start there, try it out, see if it works for you. But ultimately, low carb diet is still going to be effective. And I really should caveat that with too is that the patients that I am using this in are the ones that have tried all the things. We've done animal based or carnivore. We've tried keto. We've optimized hormones. We've looked at their nutrient status. We've like detoxed them. Like we have done all of the things and they are still resistant to fat loss. And now some people might just give you the argument like, "Oh, hey, is health at every size? Like clearly they're fine." But if their joints are starting to ache, if they don't feel like themselves, if they're maybe getting some sleep apnea because of the extra weight on their midsection, I would argue that it's not. Like just because one thing looks good over here doesn't mean all looks good. And if you can do the most that you can to get that extra excess weight and excess fat off of them faster, I think everybody's happier long term, right? Like I'll give you knee pain, for example, right? Because this is what I work with.
Mm.
Every extra pound on the body is about an extra 9 pounds of pressure on those knees. So if you've got these degenerating, painful knees, you certainly don't want to keep more fat on for longer. We will work hard to get you there. Metformin, there was a study done. I forget what they called this study, but it was done years ago, and they were basically looking at the anti-aging properties of metformin, likely coming from this glucose management standpoint. You're reducing glycation in the body, which is reducing these advanced glycation end products mimics the ages, which is inherently reducing, your aging or your general inflammation in your body with the use of metformin. And it didn't really go far. That's why it didn't really go far. People really didn't love using it because metformin came with its own problems, namely mitochondrial dysfunction and damage. And it's going to zap some of your B vitamins, specifically B12. So if people weren't kind of shifting for those things and maybe doing a mitochondrial support or supplementing with additional B vitamins, they were causing more harm than good long term. So I'm not necessarily a proponent of metformin unless it's absolutely necessary. But the peptides have been, in my experience, in my patient populations, relatively safe and well tolerated in most people. And they've actually produced other changes in these populations that have been incredibly useful. So some people do have just this emotional addiction to food. These peptides have been able to curb addictions in people, everything from alcohol to sweets to cheese to porn. Like, it just kicks out addictions, which is really freaking cool. There are studies that actually show it'll enhance neuronal growth in the brain, which is nice. They say that Alzheimer's is type 3 diabetes. Well, of course, your brain's going to start to regenerate if you start taking out all that carb attack that it's experiencing. There's also even
Mhm.
positive effects in things like osteoarthritis too.
Wow. I mean, it's fascinating. So it's definitely up for debate. I mean, a lot of people are like, it is just the worst. And a lot of people are like, it is just the best. And I can see, talking to you, I can see that there's an argument for it. And I love that you always start with diet first,
Mhm.
because having that protein forward, meat based diet is just a great start. I mean, protein on its own, right? That is a GLP-1 agonist on its own, right? Just eating that protein will raise your GLP-1, right? So, I mean, that's something that you work on with your patients. It's something that you do for yourself. Like, where are you now? Like, as far as your diet, are you carnivore, meat based? What are
Yes.
you doing lately?
So they say that the definition of hypercarnivore is like 70% or more animal products. I would say I'm beyond that. I think the only like non-carnivore things I'll have coffee. Like I drink like a third cup and like maybe like 6 to 8 ounces in the morning. Sometimes I don't even finish
I'm
it.
like a full
Um,
calf.
I am so sensitive to caffeine. I'm like, my heart will jump out of my chest. Like, I'm just not that. Yeah. Third calf is good enough for me. So, and then I have like random other things that I know I can tolerate. So I went carnivore initially because I had pretty serious health issues that I was dealing with. I had decades, like literally like 2 decades of IBS that was killing me. I had severe adult acne. I had really bad chronic pain, really bad anxiety, and carnivore. And I would say I was pretty strict carnivore for about a year, and it fixed so much. Then I got pregnant. And I actually posted a YouTube video, and it was like my first 25 weeks of pregnancy. I walked through everything that I did. And I had to be more flexible with that because I got severe meat aversion in my first trimester. So I was having like a small amount of fruit. I like tended towards more dairy. I did a lot of like the Equip protein shakes, actually, which I think we both love Equip. But I
Love.
wouldn't call those things full carnivore because of the additives and stuff that they might have. And then once I got through pregnancy and I realized like, okay, I'm doing a lot better. I'm no longer like really having to be as strict. So I started testing things, and there's a few things that I can eat that are non-carnivore foods that I know don't bother me. So avocados don't bother me. Like
Mhm.
you, tomatoes don't bother me. So I can do
Tomatoes.
like a pasta sauce, which my like Italian heritage feels really good about.
Oh, I
Um,
love it. Tomatoes
sometimes
are sometimes they're just life.
so, like, being able to just put a little bit of pasta sauce on some meatballs, and, I don't ever buy the ones with, like, added sugar to it or seed oils or anything, so it's, like, maybe a couple tablespoons a quarter, like, not, like, in a year, like, I go through phases on things that I eat. What else? Sometimes, like, if I'm out at, like, a restaurant or something, like, for example, we went to, True Food yesterday, we took the kids for dinner because my daughter graduated kindergarten, and
Oh, congratulations to her.
they have this grass-fed burger on the menu, and it comes with these, like, mushrooms that are cooked on it, and I can tolerate those. They don't hurt my stomach, they don't activate my chronic pain, and I'm totally fine. I tested broccoli one time, like, a few months ago,
Mhm.
messed me up completely. One little tiny piece of
Yes.
broccoli, and it messed me up. I was like, "Okay,
I
that's
same.
out." Yeah, I tested iceberg lettuce one time. That messed me up too. My stomach looked like I was pregnant. Messed like, so I have
It's
very few things.
incredible.
Yeah, and I would say I am for sure 90% carnivore most days, if not 100%, but I'm on my diet. Like I'm on what's working for me and I'm eating based on my goals. And like right now, right now I'm kind of like almost a dairy-free carnivore minus the cream in my coffee because I'm just not in the mood for dairy these days. But I'm sure there'll be a point where I will cycle some in and, I will be more carby from that dairy just because that's what I'm eating,
Mhm.
and I think it's important to just do what works for each individual person and yeah.
Oh, absolutely. I mean, say it again. It's like the having that ability to know yourself and know that you don't need to be dogmatic. You just need to test some things, see
Yep.
what works for you, and then live sort of in this mellow space with some flexibility. And if full carnivore is what makes you feel your best, do it. And if not, there's no shame in that game. It's like do the things that work for
Mhm.
you and let's all
Yeah.
move on with life, right?
I'm so
So
with
I'm
you.
curious, you have 3 children. Were they all did you continue to stay as carnivore through the 3, or did you have the same sort of meat aversions and have to add in fruits and things
So
for all
my daughter was just so when I conceived my daughter, she's 6 now. I was what we'll call plant heavy paleo. I I would still eat meat, but I would aim for like 10 different plants every single day, and that was just what I believed at that time, like coming out of naturopathic medical
3?
school, everything was like plants are amazing, and everybody in that space teaches that like if you have gut issues, it's because you don't get enough fiber and you need more plants. And so I had gut issues and I would eat more plants and they would never get better, but you're just so in it that you just don't like you're just so in it and you're so brainwashed. And it was, the whole thing like definition of insanity is doing the same thing over and expecting different
Mhm.
results. And, it was wild that everything healed when I cut out all the plants. So,
It's
yeah,
it's
plant
absolutely amazing.
with her. So she, and then when she was born, I was still kind of eating that way. And I didn't really switch to carnivore until my middle child was about 1. And so
Mhm.
he was 1, and so I was still nursing him. I nursed him till he was about 2, while I was carnivore. Didn't see any change in my milk supply, and in fact, like body composition changed. I just had everything change for the better, like everything. And this is why I'm so passionate about this way of eating, even if it is just a short term, elimination diet for some people, because I really don't think most people will get the privilege of knowing how their body feels when you take all the inflammation away and just put in all the really good essential bioavailable nutrients. Like it is, I think it's a privilege to be able to do that. And I love when people like take me up on it and are willing to try it out. But so with him, yeah. And then I guess carnivore made me super fertile because after I was done nursing him, I didn't even get a menstrual cycle before I ended up pregnant with my third. So
Wow.
carnivore infertility is 100% a thing. And I
That's a
was just
thing.
like, yeah, it was like, hey, first ovulation after nursing, one and done. Yeah, it blew my mind. Complete shock for all of us. Blessing, of course. Like we love our children for sure. We were happy, but weren't planning it. I was expecting like, yeah, I'm just gonna get a period. We'll track the cycle. We'll make sure that like, we're gonna God had other
Oh,
plans.
surprise.
So the meat aversion was interesting, and the only reason that I had some fruit then is because it really hit me the worst when we were on a vacation. We'd planned this vacation before I ever even got pregnant, and we were doing a time through Turkey and Egypt. And on the boat that we were in Egypt when we did this like Nile River cruise, there was only certain meal times and it was only what they were making. Like you had no other options for food.
Mm.
And sometimes the food that they were making would be cooked in seed oils, and I know seed oils specifically messed me up. Like my acne was seed oil acne. I would get it all on my chin, chronic pain, like 100% seed oils because I've tested it. Like if I eat something really seed oil ridden, I'll get a breakout, clear as day.
Mhm.
So the safest thing for me to eat on that boat, which I ate for like 3 or 4 days, was they had full fat yogurts with no sugar added, and then they had fresh fruit. That was what I had available. And I wasn't gonna
Yeah.
starve.
Mm.
I was 12 weeks pregnant. Like, I'm not gonna not eat. Like, you're just not gonna not feed this pregnant lady. So I ate what I could, and that's what it was. And then as soon as I was able to get back to my normal time, I switched back. And that was when I had to get a little more flexible and creative with my meat aversions. And that's when I started adding back in like condiments and seasonings. So I was able to get ground beef back in without too much meat aversion. Steak was the worst for me, but I would make taco bowls, and I would make like my meatball bowls, like I've told
Mhm.
you about. So the deconstructed meatballs where I'd put the pasta sauce on them with some shredded cheese, or my taco bowls would have like the shredded cheese but some avocado, so maybe some sour cream. I also would make like burger bowls, and I would maybe throw like a couple pickles on there. I actually realized pickles don't agree with me, so that stopped very soon. But I did what I could, and I added in the condiments and the flavoring so I could just get it down.
Amazing. I mean, it's great. Your children are beautiful. It's you have a lovely family, honestly, just beautiful. I wanted to ask you that because you had a little scare in January that
Mm.
you shared on Instagram, and I'm just wondering now you've had some time to reflect. You had like a little mini stroke, and there's a technical term for it that I won't try to pronounce. But can you discuss like what happened and what are your thoughts on why?
So it's a TIA, and it stands for transient ischemic attack. Basically, you get all the signs and symptoms of a stroke, and then it just goes away in about 4 or 5 hours. And that was exactly what happened. So
Amazing.
I was at my daughter's gymnastics, and my husband had called me, and as we're talking, he's like, "You sound a little weird." And I guess I was very spacey. I wasn't really kind of like making a lot of sense, couldn't really understand him. And I was like, "Oh, I think I just got really tired all of a sudden. Like I just feel really tired." And so after she was done gymnastics, we were supposed to go shop for like one little thing. And so we get in the car, and I'm driving to the place that I'm going. And as I'm driving, I start noticing like my right side of my face is starting to droop, and it's like weak and like numb and tingly. So we get to the place, and I called my husband. I'm like, I don't know what to do. I think I'm having a stroke, and I just don't know what to do. Like I was just my mind went blank. I was like, what do I do? What do I do? And so he's on the phone with me, and he's like, "Okay, drive home. I'm going to stay on the phone with you." And like I have my daughter in the car. I've got the baby with me in the car too. And he's on the phone with me, and he's like, "Okay, how are you feeling?" Like trying to keep conversation going, keep everything going. And I can feel it just getting worse. Like my whole right side is just like going numb, losing sensation. I'm like praying, like, okay, make sure my foot can at least still hit the gas, hit the brake, like just focus, focus, focus. And I'm driving home, and I'm like, actually, I think you should just meet me at the hospital. Like, I think I just need to go to the ER. Like, I don't, this feels really bad. Like my feet, like cheeks, like down to here, my eyes like drooping. I'm looking in the mirror, and I'm like, damn it, like this is happening. It was so scary. So we get to the hospital, and my husband meets you there in the parking lot. And this brilliant man, and so this is actually another part of the story that is interesting. He brought me a handful of systemic enzymes like serapeptase, lumbokinase, nattokinase, and he's like, "Just take these." And I'm like, "Oh, of course." Like, so I take the handful of enzymes, and it's funny because that like one thing makes me realize like I don't actually know if this was just a TIA or a real stroke, and those things just work to dissolve it because in 4 hours I was better. So I'm like, did he save
Wow.
my life? Like, was it a full on stroke? But that's what they assigned it as. So I get in there. He takes the kids from me. I go in. They can obviously see what's happening. So hospitals treat strokes very seriously, which, testament to them. They got me in right away. I was in a CT within like 10 minutes. Like it was rapid. And so they do the scan and everything, and they hit you with all of it. And they pull some blood, they do all that. They found like a couple like weird things that were off metabolically. They were annoyed. They were like they hooked up a bag of dextrose to me because my blood sugar was low. I'm like, I'm
Oh, no.
keto. Like it's
Right.
fine. Like I'm used to running. Like I have low blood sugar. Like that's just what it is. But I'm good.
Right.
Like I,
I
anyway.
feel like we all need bracelets, like, "Do not administer glucose, keto." Like, we need a bracelet. Yeah.
I know. They're like, well, if you go against medical advice, I'm like, it's just a bag of dextrose. Like, I'm going to be fine. Like, it's not going to be the end of the world.
Mhm.
And I basically made them, I was like, okay, they ran it for like 10 minutes. I was like, can you check my blood sugar and just like see that it came up and like disconnect this? Like, I just don't want any of this. But yeah, within like 4 hours of being there, my symptoms just started to go away. Like, my face went back to normal. My eyes went back to normal. I was talking normal. The numbness and tingling went away entirely. And they're like, yeah, it was probably just the transient ischemic attack. Something just shut off a little bit of blood flow.
Wow.
Could have been anything. And, there's so many things that could have played into it. At that point, we were living in a house that had mold in it. And there are certain mycotoxins that could cause something like that. There's links between these stroke-like events and people who have ADHD, which I do. So I've got that neurodiverse brain. So there's the potential that there's could have just been some blood flow stuff in there happening. And then, I had low folate. I had randomly high vitamin K2. Like there was just things that were weird that were off. And I don't even know what could have caused it besides maybe just stress and having a new baby. The body is just kind of really weird when you're going through those changes. And I haven't had any concerns since at all. It
Oh,
was
good.
kind of like
I'm
this
so
one
glad.
and done thing. And, I checked my own labs after I did everything else. Like nothing else was wrong, just a weird
Oh,
incident. And I'm
I'm
not the only person. When I shared that story, you wouldn't believe the number of messages that I got on my Instagram being like, same thing happened to me, same thing happened to me. And at the hospital, they'll have you believe, like, oh, you're a young, healthy white woman who doesn't do anything wrong. Like, this should never have happened. But apparently it does. They're like, oh, you don't smoke, you don't drink, you don't eat any, bad food, you have no like inflammation, you're in physically good shape. And they're like, we don't know what happened. Apparently, it
interesting,
does
but
though.
it's more common than you would
Way
think,
more
than
common than
they would
people think.
lead you to believe.
Yep.
Well, I'm so glad that you're okay, that all worked out well, and you are absolutely, like, managing a lot of things. I mean, I we were talking earlier about stress, and I mean, so 3 kids, husband, family, the job, the Instagram. You
Yeah.
have a lot going on. How do you manage stress? I think you and I have very similar thoughts about stress is a killer.
Mhm.
Stress will get you in the end. So what do you do to best manage stress?
Gosh, working out is a really, really great outlet for me if I can kind of like process that stress through my body and not let it like live in here, so to speak. I feel so much better. I really prioritize sleep though. Like that is kind of my one non-negotiable. I make sure that I'm in bed for at least like 8 to 9 hours, sometimes even 10, in the hopes that I'm getting somewhere between 7 to 8 hours of sleep pretty much every night. And then I also really kind of focus on things that I can do for optimizing mitochondrial function. So, our mitochondria are the powerhouses of our cells. So, they're the things that will actually produce all of our intracellular energy. And there are certain things that you can do to make sure these guys stay happy and healthy. So, getting some sunlight, some red light, grounding, really great for the mitochondria as well too. Then I will take some supplements to really kind of optimize things as well. I like NAD for mitochondrial health. There's also a couple of other just like nutritional blends and nutrient blends that I keep on hand for whenever I need like an added boost. But yeah, it's just a matter of for me supporting that physiology and then also understanding like if you're not dealing with some stress, you're probably dead because life is some degree of stress and it's a good thing to have some of it, but it's all really in your response to it and the handling of it and not letting it handle you.
Absolutely. This is an area that I really want more people to focus on. Like you said, sleep is
Mhm,
so important. That's where we sort of like flush the system and restore for the next day. And to manage stress is impossible if you're not getting good sleep.
mhm.
And so people, I think, discount the importance of sleep and stress management, and I appreciate your tips there as well. So now, um, we have not yet discussed much about hormones and HRT. I'm leaving this to the end because we've got some Instagram questions that related to hormones. If you don't mind, I'll just get into those questions,
Do it.
and we'll just answer quickly a few of those. So someone asked, what are the best blood tests to get to check for hormones? And I'm going to add to that, like, then the timing of that, especially for women,
Mhm.
as far as their age and as far as cycle.
So, when it comes to timing of the blood draws, there's a difference between if you're premenopausal versus menopausal. If you're menopausal, it really doesn't matter because you're no longer like cycling, so to speak. Like you don't have a period happening. If you're a premenopausal woman and your cycles have gotten strange, The best time to test is usually on day like 19, 20, 21, or 22 of your cycle, with day 1 being the first day that you bleed from your menstrual cycle. So the first day you bleed is day 1, count upwards through day 19, so 19, 20, 21, 22. And that's going to give us kind of the best indication of specifically kind of what your progesterone is doing, because a lot of premenstrual women's hormonal issues come from either progesterone, usually progesterone being deficient, either in and of itself being deficient, or creating what we might call like an estrogen dominant state. So that's really an important thing to look at for that. Now, if there are concerns more towards the actual menstrual cycle itself, like the period itself, sometimes those can be more estrogen mediated. But we really have to kind of pay attention to symptomology and what the person's coming in for. But most often than not, it's that like mid cycle or towards the end of the cycle testing period. As far as what to like labs to look at, it depends on the individual for sure and what we're trying to analyze. At a very bare minimum, we like to look at just like your general blood counts. So, red blood cells, white blood cells, a metabolic panel to kind of assess liver function, kidney function, your electrolytes, your blood sugar, and then, of course, the hormones themselves. So, the estradiol, the progesterone, and then I usually love to look at also testosterone, especially in women. And sometimes we'll even add on things like your cortisol or prolactin or DHEA, just depending on like the picture that we're looking at. And that's for sex hormones. We also love looking at thyroid, because there really is this deep interplay between your overall thyroid function and then what can be happening downstream with your other sex hormones, just depending on even things like your stress levels, your adrenal function. And even diet wise, like certain diets can actually induce thyroid dysfunction because they don't provide enough nutrition and energy, and so the thyroid starts to work overtime to produce that energy for the body, and you can end up in hypothyroid states, adrenal fatigue states, and other low hormone states as well too. But beyond that, sometimes I also like to even look at like nutrients, so like your vitamin D, your B vitamin levels, iron levels too, storage form of iron, which is your ferritin. We do like to look at cholesterol. We like to look at other inflammatory markers that can be related to the cholesterol, like your HSCRP or oxidative LDL. It's usually not just like, just look at the hormones. It's really the
Right.
whole picture of the person, so we can get the most data and make like the most detailed and specific plan possible to get that person better.
That's excellent. Thank you so much for that. Yeah, rather
Mhm.
than just sort of like throwing darts and saying, well, we're just going to measure this little thing, just take the whole full picture and then really
For sure.
see the full story. Such a great
Mhm.
answer. Thank you. Next question was, what are your thoughts on intermittent fasting for perimenopausal women? Do you find that helpful?
Depends on what the goal is. I think intermittent fasting is great when done in the right person, as long as they're actually paying attention to what's happening during their eating window. The biggest mistake that I see in women who do fasting is they are then chronically under eating when it is time to eat, and they're still putting themselves into this nutrient deficient state, which is actually going to cause more stress and damage and harm to the body. There's an elegant way to do it, but you have to be so diligent and like eat enough. I intermittent fast a lot because I feel good when I do it, but I eat a pile of food. Like, I'm sure you've seen, like, I share, but I eat, and I eat a
Yeah.
lot. And most people are like mildly disgusted by how much food I can put away if they like eat with me and they're not prepared. And because they look at me and they're like, where's it all going? And I'm like, it's fueling me. Like, I think in women in general, it's a whole other topic, but we have been led to believe this lie that we somehow just need to eat like birds and we're going to be fine. But we have so many complex processes happening in our bodies all the time, like literally the ability to create a brand new life form. And we're supposed to sustain ourselves on salads and biscuits because we're just little dainty women. I think it's BS. Like,
It's
but anyway,
insane what we're expected to eat. Like a large salad with like 3 ounces of turkey is going to cut it for us. Like we absolutely need all those nutrients.
yes.
Give me the big meaty meal. Like when I go out with my husband and I order the steak, he orders a salad with the chicken on top. It always gets, mixed
Yes.
around. The server is always handing me his salad, and I'm like, "No, no, no, no. That's not his salad." I mean, that is his salad.
Yeah.
I'm the steak. So, yeah, we
Yes.
need that food.
We do, and that's my biggest thing is, like, don't start fasting if you're also not gonna feast. Like, you have to make sure you're getting adequate nutrition in, especially if your body is not responding how you want it to. So, yeah, if you're trying to lose fat, if you're trying to, like again, depends on what the goals are, because fasting can be for anti-aging, it can be for helping, like, loose skin get go through autophagy, so it starts to get tighter. You can use it, of course, for fat. You can use it for enhancing cognitive function because you get more ketones going through, the brain starts lighting up better. What's your goal? What's the purpose? Address it then, and just like eat enough.
Eat enough. We're
Mhm.
a bunch of chronic undereaters. I'm totally with you on that. Okay, so then last question. What are this is coming from a man? What are the best ways to raise free testosterone in men over 50? How can
Oh
you do
my
that sort of on your own?
Make sure you're eating plenty of protein. Make sure you are not eating sugar, drinking alcohol. Gosh, there's so okay, so I think the better question slash approach to this might be like, how do we prevent testosterone decline, so to speak? Because
Mm,
a man, his testosterone should stay high throughout his entire life. Like he doesn't go through menopause like women do, where he loses that. Men can father children until the day that they die because their levels are supposed to stay high. So if we kind of switch it and say, well, what do we need to not be doing to ensure these levels stay high like when I'm 18? I think it opens up a broader range of what we can talk about. So there are so many things in our environment that will actually cause damage to our endocrine system. Plastics are a really big thing, and guys might not pay attention to this, but like plastics are technically polyester clothing. If you are wearing these underwear that are polyester, these pants that are polyester, and these things are tightly gripping those man parts, and you're applying heat because it's hot down there and those pores are
mm,
opening up, what do you think is happening to those little swimmers? They're getting microwaved in plastic, so to speak, right? Combine that with putting your phone in your pocket. There's another thing added to it. And then, of course, we have just like all the environmental toxins as well in like beauty products, body washes, shaving creams. Alcohol intake is like a really big thing for knocking this stuff down. Carbohydrate intake, another really big thing, because there's this like cycle of like how carbs influence sugar, which influences insulin, which influences your estrogen levels. So you can actually start making more estrogen from your testosterone. So testosterone isn't the end product. Testosterone can actually now convert to estrogen. So you start getting now the man boobs, right? And gosh, even like the environmental estrogens, like these soy based products that people are drinking, the additives in the food, like all these, there's a whole like list of things that we could go after
so
with
much to
this.
avoid. Yeah.
But it's a lot of it is just like the crap in our environment. And if you just start avoiding those things, go back to like this more ancestral way of thinking, make sure that you're lifting weights, that your body composition is staying leaner because, like I was saying, that process of turning testosterone into estrogen, it's a process called aromatization. It actually occurs in fat tissue. So the less
Mm,
excess fat you can have on your body, the less surface area you have for that process to occur, the more you'll keep your testosterone as testosterone versus then converting it to estrogen. So it's layered, it's nuanced, but you definitely have to start with at least those basics and then see how things shake out from there and what else you might need to do.
I love it. Thank you for that.
Yeah.
So, Dr. Salt, thank you so much for your time. I have learned so much, and I'm sure our listeners and viewers have also learned so much. I appreciate your time like you wouldn't believe. Thank you for all the great information. Tell us, where can people find you and how can they reach out and maybe meet with you for an in-person appointment?
Yeah. So I'm most active on Instagram, and my handle on there is just at Dr. Solt. So DrSolt. My clinic website is stemcelltherapypro.com. That's where you can find out more about what we do clinically. And if you need to, you can actually schedule a discovery call on there to learn about becoming a patient and if we're going to be the right fit for you. So yeah, check it out. Check me out either place.
Awesome. Thank you so much. I'll put all that information down in the description. Again, I appreciate you and enjoy the rest of your day. Thank you.
Thank you.